Hi, this is Caitlin, and this is my appendicular skeleton video. So first we're going to start out with the pectoral girdle, or the shoulder. So the bones that create our pectoral girdle starts with the clavicle, which is this bone right here. It's also the collarbone. So we have the acromial end of the clavicle, and it's the furthest point out towards here. Next we have the sternal, which is the medial end or the middle. It rests on the sternum. So the inferior surface of the clavicle is rigid and grooved because it's the attachment site for multiple ligaments. It also acts as a muscle anchor, and then it braces, so it holds out the scapula and the arms lateral. So it allows us to hold our arms out like this. Next is the scapula, or our shoulder blade. So we have the whole bone right here, and there's the coracoid process, which is the pointy part on the outside right here. Then we have the subscapular fossa, which is the flat surface of the blade. Next is the glenoid cavity. So it's pit-shaped, and it forms a joint by articulating with the humerus. Next is the spine. So it's the predominant line on the posterior side of the scapula. Next is the acromion, which is the end of the spine right here, and it articulates to the humerus. Articulates to the acromial end of the clavicle. So it's this topmost point right here. So next we have the acromion, which is the end of the spine, and it articulates with the acromial end of the clavicle, and it creates the acromioclavicular joint. Next is the supraspinous fossa, which is the flat part of the blade just superior to the spine, this part right here. And then we have the acromioclavicular. Why is that so hard for me to say? Where the acromion and the acromial end of the clavicle articulate, like I already said. So next, we're going to move on to the upper limb. The topmost superior part of the upper limb is formed by the humerus, which is the largest and longest bone of the upper arm. It articulates to the scapula at the shoulder blade. And also to the radius and the ulna inferiorly. So first we have the head, which is the rounded part of the superior of the bone, which fits into the glenoid cavity, and it allows the arm to hang freely, as it's shown right here. Next we have the greater tubercle, which is inferior to the head. It's the outside tip right here. It's almost like a little divot. And then we have the lesser tubercle, which is medial to the head, and the greater tubercle right here. So those are sites of attachment for the rotator cuff muscles of the shoulder. Next we have the deltoid tuberosity, which is the lateral V-shaped part, where it kind of comes to a little bit of a point right here. And that is where the deltoid muscle attaches to the bone. Next we have the medial epicondyle, which is the medial bottom point of the humerus. And then the lateral epicondyle, it's actually the back of the medial epicondyle. So both are sites for muscle attachment. Next we have the coronoid fossa, which is the middle depression, and right here, which allows the ulna to move as the elbow is flexed and extended. And then we have the capitulum, which is this part right here. It's the ball-like part of the humerus. And then the trochlea, which is medial to the carpitulum. Together they articulate with the ulna and radius below. And then we have the olecranon fossa, which is the posterior depression back here. It's a site of attachment for the ulna. It works with the coronoid fossa to move the ulna as the elbow is flexed and extended. So next we have the forearm, or the antebrachium. And it's these two bones right here. So first is the ulna, which is slightly longer than the radius. It's the medial bone of the forearm. So it's slightly longer than the radius. It's mainly responsible for forming the elbow joint with the radius. So first we have the olecranon, which we kind of already touched on in the previous section. It's the elbow bone, so it's the superior head of the ulna right here. So next we have the forearm, or the antebrachium, and it consists of the ulna and the radius. So first we have the ulna, which is slightly longer than the radius. It's mainly responsible for forming the elbow joint with the radius. First we have the olecranon, which is this point right here. It's the elbow bone, so it's the superior head of the ulna. If you can see it better from the posterior view right here. And then we have the coronoid process, which is the anterior point of the head. Together they form a hinge joint that allows the forearm to bend. So together they form a hinge joint that allows the forearm to bend. And when the forearm is extended, the olecranon locks it to keep the forearm from hyperextending, so it can't bend too far back. It can only hinge forward, prevents hyperextension. And then next we have the styloid process, which is the outside point of the inferior ulna head. It forms a ligament that runs down into the wrist. Sorry, it's kind of hard to see. Next, we're going to move on to the radius. So that's this bone right here. It's slightly shorter than the ulna. We have the head, which is the top of the radius. It superiorly articulates to the capitulum, medially articulates to the radial notch of the ulna. Next, we have the radial tuberosity. So it's the V-shaped, just inferior to the head right here. It anchors the bicep. Next is the styloid process. So it's the lateral point of the inferior head. It's the anchoring point for ligaments that run down into the wrist, which now brings us to the carpus. So there's a proximal row. It's the superior row of bones right here. If I go lateral to medial, it's the scaphoid, which is closest to the thumb. Sorry, keep dropping it. Scaphoid, the lunate, and the triquetrum, and then the pisiform. Together, they all form the wrist joint except for the pisiform. Next is the distal row, and we have the trapezium, which articulates to the pollex, which forms a joint. And then the trapezoid, the capitate, and the hamate. Next are the metacarpals, which are the topmost parts of the hand. They articulate to the proximal row, and they form the metacarpus, or like I said, the hand. Next are the phalanges, which are the 14 miniature bones that articulate to the metacarpus, and they form our fingers. Now we're going to move on to the pelvic girdle. Let me tilt you down so you can see a little bit better. So it's this part right here. It's the attachment site for the lower limbs to the axial skeleton, and they transmit the weight of the upper body down into our lower limbs. They support the organs of the pelvis, It's not as mobile as the pectoral girdle, but it's much more stable. So first we have the coxal bones, or the hip bones, which are seen on either side. And during childhood, the coxal bones are made up of actually 3 separate bones that fuse together as we move into adulthood during puberty. But they're the ilium, which is the topmost part, and then we have the pelvis, and then the ischium, which is this part down here. So if we start with the ischium, we have the acetabulum, which is the socket where the ilium, pubis, and ischium fuse together, so it receives the head of the femur. So it's this rounded part. Let me reach through. This rounded part right here. Like I said, it receives the head of the femur, so it creates the hip joint so that we're able to walk and move our lower limbs. And then we have the pubic symphysis, which is the fibrocartilage discs where the 2 pubic bones join together. Next is the orchiature foramen. So it's the large opening in the hip bone where the blood vessels and nerves are able to pass through, down in here. And then we have the iliac crest, which is the thick superior margin of the hip bone. Many muscles attach here. Then we have the anterior superior iliac spine, which is the bottom of the crest, down here. Then we have the iliac fossa, which is just the flat medial concave part of the ilium. Next, we have the greater sciatic notch, which is easier to see from the side. Hyperextension. And it's the deep indent of the ilium right here. The sciatic nerve passes through and enters into the thigh from this point. Then we have the ischial spine, which projects medially, this part right here, into the pelvic cavity. So it's the site of attachment for the sacrospinous ligament. Then we have the ischial tuberosity. So it's the inferior surface of the ischium. So it's the strongest point of the hip bones right here. All of our weight is put onto these bones while we're sitting. It's also the site of attachments for the sacrotuberous ligament as well as the hamstring. So then if we move down into the lower limb, I'm actually going to prop him up here so that we can see it a little bit better. So now we're going to be looking at the femur, or the thigh bone. It's the longest, largest, and strongest bone in the body. And it articulates to the hip bone at the head. It's this ball-like top portion of the femur. Then we have the greater trochanter, which is the lateral projection at the top. If you can see it, I guess it is easier to see from the side. And then the lesser trochanter, which is the posterior-medial projection right here. Together, they create attachment sites for the thigh and buttock muscles. Then we have the adductor tubercle, which is the top bump of the femur right here. Another site for muscle attachment. Then we have the medial epicondyle. So it's a medial bump just inferior to the adductor tubercle. Next we have the lateral epicondyle. It's the lateral bump or inferior head. And then the medial and lateral condyles, which we need to turn around for you to be able to see. So we have the medial and lateral condyles. They're the posterior sides of the medial and lateral epicondyles. They help form the knee joint. So then if we move on to the patella, it's a knee bone. It's a sesamoid bone. It's enclosed by the quadriceps that secure the anterior thigh muscles to the tibia, and it also protects the knee joint, which sits just inside. Next we have the tibia, or the shin bone, which is this large bone right here, the lateral shin bone, or I'm sorry, the medial shin bone. It receives the weight of the body from the femur and transmits it to the foot. It's the second largest and longest bone in the body. So we have the medial and lateral condyles. They're the points of the tibia's head. They articulate to the femur condyles up above. So we're looking at these two sides. So we have the medial and lateral condyles. Then we have the tibial tuberosity, which is the attachment site of the patellar ligaments. It's this pointy part right here. Then we have the medial malleus, which is forms the medial bulge of the ankle right here. And then we have the proximal and distal tibiofibular joints. So like I said, proximal is the superior joint where the tibia and the fibula articulate up here. And then the distal, so the inferior joint or the distal joint, where the tibia and fibula articulate. So then if we move on to the fibula, which is the smallest of the leg bones, it's lateral to the tibia. It articulates proximally and distally to the lateral aspects of the tibia. It doesn't bear any weight. It's just an attachment site for many of your leg muscles. So we have the head, which is the most superior part of the fibula. And then we have the lateral malleus, which is the most inferior part of the fibula, and it forms the lateral ankle bulge. It articulates with the talus. So now if we move on to the foot, or the tarsus, it's made up of 7 bones, also called the tarsus. Tarsals. They form the posterior half of the foot. So first we have the talus, which is the ankle bone. It's kind of hard to see. It's actually easier if we look at it from the back side. So it articulates superiorly with the tibia and fibula, and then inferiorly with the calcaneus, or the heel, which carries the talus. So next we have the cuboid, which is the lateral tarsal. Then we have the navicular, which is a medial tarsal, and then the medial, intermediate, and lateral cuneiform bones, which move up the foot on the lateral side. They articulate with the metatarsal bones anteriorly. Then we have the metatarsus, which supports the body weight. It articulates, it's so awkward, the metatarsals, which supports body weight and articulate with the proximal phalanges to create the ball of the foot, which is this part, the middle part right here. And then we have the phalanges, or the toes, which are the same as in the hand, just less nimble. Same amount of bones, 14. They're like miniature long bones that create our toes. And then we have the hallux, which is just the big toe, and it's 2 phalanges. All other toes have 3. The big toe has 2. So that's it. Thank you.